Congestive heart failure is a big topic, so we're going to try and cover this in a few different videos. But this is an overview just so we can kind of get a basic idea of what the word means and how we deal with it. It's an important question because it accounts for uh, more hospitalizations than any other disease in the 65 and older population. It's characterized as the inability of the heart to supply blood flow to meet the needs of the body. Sorry about the typo there. And it's often called congestive because when you can't pump fluid properly, then you get stasis and you get fluid that accumulates in the interstitium. So you get edema, either pulmonary or peripheral. It can be chronic as well as acute decompensated and right-sided versus left-sided. So for causes of right versus left-sided, we'll talk about the different causes, but the most important thing to remember is the most common cause of right-sided heart failure is left-sided. And when we talk about acute decompensated heart failure, that's usually a chronic heart failure that decompensates or reaches a point where it just collapses. So if you have, especially in a acute ischemic attack, a heart that is already in failure will just quit working if it doesn't get enough blood supply. So the major causes are ischemia. Cigarettes can poison the heart muscle. Hypertension can cause the heart muscle to have to work too hard for too long. If a heart muscle is laid down too quickly, if it hypertrophies, then it can have an irregular and weak muscle structure, and it can become fibrotic and ultimately lead to the inability of the heart to pump properly. Obesity has some of the same problems. Diabetes can cause vascular disease and also poison heart muscle. Valvular disease, like hypertension, causes the heart to work too hard. And then infectious and inflammatory causes can cause direct damage to the heart muscle, as well as drugs. So the symptoms vary depending on which side of the heart. The picture that I have here kind of shows both right-sided and left-sided heart failure, which you would see in many left-sided heart failure cases, because again you get right-sided heart failure from left-sided heart failure. And the physics behind these symptoms is pretty simple. If the left side of your heart is backing up, is not pumping up properly, then that blood is going to be stuck in the lungs. So your lungs are not going to function properly. There's going to be fluid building up, which gives you dyspnea, orthopnea, and paroxysmal nocturnal dyspnea, which, by the way, you can also see in right-sided heart failure. Peripheral edema, nocturia, ascites, and hepatomegaly are all associated with right-sided heart failure because the blood is backing up in the body because it's not being pumped properly by the right side of the heart. Some of the signs are associated with these same physics principles. You know, if we have fluid backing up into the lungs, you get rales, edema, cyanosis due to not getting enough blood to the peripheral tissues, and a gallop rhythm. And in the right-sided, again, we have peripheral edema. Your jugular venous pressure increases, as you can see in the picture here, and you can get a parasternal heave. So the echo is going to be the major test that you use for classifying and diagnosing heart disease or heart failure. You look at the stroke volume, you look at the ejection fraction. Those two things help you to know how well the heart is actually functioning. A chest x-ray will show cardiomegaly as well as curly lines. These are not referring to the shape of the line, but they are referring to um, lines created by pulmonary edema. An EKG can be useful, but not specific. Angiography can help you to determine the cause of the heart disease. The Framingham criteria are kind of a more quantitative way of classifying what actually is heart disease. I'm not going to read down this list. This is something that you can look up, but it talks about the symptoms that we've already mentioned, and if you add up enough symptoms, then you can say with certainty that somebody has heart disease. The major management of heart disease is medical, though lifestyle modifications are important. ACE inhibitors are prescribed to basically everyone with heart disease, and it's been shown that it can help reduce damage to heart muscle and even encourage rebuilding of healthy tissue. Loop diuretics, beta blockers, vasodilators, all of these just help reduce the work that the heart has to do. So you remember, if this cause is being caused by the heart being overworked, then if we can reduce that work, then we can help the heart to heal. Lifestyle modifications include diet and exercise. A defibrillator may be necessary if we've done enough damage to the heart and its conduction system, and in extreme cases you may need a heart transplant. These are the credits of the images that were used. These are all Creative Commons images, so you can look them up and use them in your own stuff if you'd like to. Please make comments. Aside from it being a little bit boring, please help me to make sure that I've got good information in these. And thank you.